Which is the most common cause of atrial fibrillation? Option 1. Hypertension. Option 2. Coronary artery disease. Option 3. Diabetes mellitus. Option 4. Hyperthyroidism. The answer is option 1. Hypertension. Which arrhythmia is characterized by a rapid and irregular heart rhythm originating in the atria? Option 1. Atrial flutter. Option 2. Atrial fibrillation. Option 3. Ventricular tachycardia. Option 4. Bradycardia. The answer is option 2. Atrial fibrillation. Which is the primary mechanism behind ventricular tachycardia? Option 1. Re-entry circuits in the ventricles. Option 2. Increased vagal tone. Option 3. Enhanced automaticity in the atria. Option 4. Delayed after depolarizations. The answer is option 1. Re-entry circuits in the ventricles. Which arrhythmia is life-threatening and requires immediate defibrillation? Option 1. Atrial fibrillation. Option 2. Ventricular fibrillation. Option 3. Sinus tachycardia. Option 4. Atrial flutter. The answer is option 2. Ventricular fibrillation. Which is the hallmark ECG finding in atrial fibrillation? Option 1. Sawtooth P waves. Option 2. Absent P waves with irregularly irregular QRS complexes. Option 3. Wide QRS complexes. Option 4. Prolonged PR interval. The answer is option 2. Absent P waves with irregularly irregular QRS complexes. Which antiarrhythmic drug is commonly used to treat ventricular arrhythmias? Option 1. Amiodarone. Option 2. Verapamil. Option 3. Adenosine. Option 4. Digoxin. The answer is option 1. Amiodarone. Which is a common side effect of beta blockers used to treat arrhythmias? Option 1. Bradycardia. Option 2. Hypertension. Option 3. Palpitations. Option 4. Tachycardia. The answer is option 1. Bradycardia. Which non-pharmacological treatment is used for supraventricular tachycardias? Option 1. Catheter ablation. Option 2. Coronary artery bypass. Option 3. Pacemaker implantation. Option 4. Defibrillation. The answer is option 1. Catheter ablation. What does the term bradycardia mean? Option 1. Fast heart rate. Option 2. Slow heart rate. Option 3. Irregular heart rate. Option 4. Skipped beats. The answer is option 2. Slow heart rate. Which of the following arrhythmias is most commonly caused by electrolyte imbalances? Option 1. Ventricular fibrillation. Option 2. Premature atrial contractions. Option 3. Premature ventricular contractions. Option 4. Torsades the points. The answer is option 4. Torsades the points. Which is the primary treatment for atrial flutter? Option 1. Electrical cardioversion. Option 2. Pacemaker implantation. Option 3. Lifestyle changes. Option 4. Antibiotics. The answer is option 1. Electrical cardioversion. Which arrhythmia can be managed with the Valsalva maneuver? Option 1. Ventricular tachycardia. Option 2. Supraventricular tachycardia. Option 3. Atrial fibrillation. Option 4. ventricular fibrillation? The answer is option 2, supraventricular tachycardia, which is a key feature of first-degree heart block on an ECG. Option 1, prolonged PR interval. Option 2, wide QRS complexes. Option 3, irregular rhythm. Option 4, absent P waves. The answer is option 1, prolonged PR interval, which is the mechanism of action of adenosine in treating arrhythmias. Option 1, slows AV node conduction. Option 2, blocks calcium channels. Option 3, increases heart rate. Option 4, decreases sodium influx. The answer is option 1, slows AV node conduction. Which arrhythmia is most commonly associated with a re-entry circuit in the AV node? Option 1, atrial fibrillation. Option 2, atrioventricular nodal reentrant tachycardia, AVNRT. Option 3, ventricular fibrillation. Option 4, bradycardia. The answer is option 2, atrioventricular nodal reentrant tachycardia, AVNRT, which is a potential complication of untreated atrial fibrillation. Option 1, stroke. Option 2, heart block. Option 3, torsades the points. Option 4, bradycardia. The answer is option 1, stroke. Which medication is used for rate control in atrial fibrillation? Option 1, digoxin. Option 2, amiodarone. Option 3, lidocaine. Option 4, furosemide. The answer is option 1, digoxin, which is the target INR range for patients with atrial fibrillation on warfarin. Option 1, 1.0-2.0.0 PTION2, 2.0-3.0.0 PTION3, 3.0-4.0.0 PTION4, 4.0 to 5.0. The answer is option 2.2.0 to 3.0, which is the main feature of ventricular fibrillation. Option 1, rapid and regular rhythm. Option 2, chaotic electrical activity. Option 3, prolonged PR interval. Option 4, absent QRS complexes. The answer is option 2, chaotic electrical activity. Which arrhythmia can be caused by hypothyroidism? Option 1, atrial fibrillation. Option 2, ventricular fibrillation. Option 3, bradycardia. Option 4, premature ventricular contractions. The answer is option 1, atrial fibrillation, which is a common symptom of arrhythmias. Option 1, fever. Option 2, palpitations. Option 3, skin rash. Option 4, nausea. The answer is option 2, palpitations, which is the goal of defibrillation. Option 1, slow the heart rate. Option 2, restore normal rhythm. Option 3, increase blood pressure. Option 4, reduce cardiac output. The answer is option 2, restore normal rhythm. Which electrolyte imbalance is most likely to cause arrhythmias? Option 1, hypercalcemia. Option 2, hyperkalemia. Option 3, hypermagnesemia. Option 4, hyponatremia. The answer is option 2, hyperkalemia. Which class of antiarrhythmic drugs blocks potassium channels? Option 1, class 1. Option 2, class 2. Option 3, Class 3. Option 4. Class 4. The answer is option 3, class 3. Which is the most common type of valvular heart disease? Option 1. Stenosis of the mitral valve. Option 2. Regurgitation of the aortic valve. Option 3. Stenosis of the aortic valve. Option 4. Regurgitation of the tricuspid valve. The answer is option 1. Stenosis of the mitral valve. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life. Which of the following conditions is associated with aortic stenosis? Option 1. Chest pain. Option 2. Fainting. Option 3. Fatigue. Option 4. All of the above. The answer is option 4. All of the above. In which valvular heart disease does blood flow backward from the left ventricle into the left atrium? Option 1. Aortic regurgitation. Option 2. Mitral regurgitation. Option 3. Tricuspid stenosis. Option 4. Pulmonary regurgitation. The answer is option 2. Mitral regurgitation. Which is the main symptom of mitral stenosis? Option 1. Shortness of breath. Option 2. Palpitations. Option 3. Cough. Option 4. Chest pain. The answer is option 1. Shortness of breath. Which valve is primarily affected in aortic regurgitation? Option 1. Mitral valve. Option 2. Tricuspid valve. Option 3. Aortic valve. Option 4. Pulmonary valve. The answer is option 3. Aortic valve. Which diagnostic test is commonly used to detect valvular heart diseases? Option 1. X-ray. Option 2. MRI. Option 3. Echocardiogram. Option 4. CT scan. The answer is option 3. Echocardiogram. Which is the treatment for severe mitral stenosis? Option 1. Antibiotics. Option 2. Valve replacement. Option 3. Valve repair. Option 4. Lifestyle changes. The answer is option 2. Valve replacement. Which is the primary surgical procedure for treating aortic valve stenosis? Option 1. Aortic valve repair. Option 2. Aortic valve replacement. Option 3. Mitral valve repair. Option 4. Pulmonary valve replacement. The answer is option 2. Aortic valve replacement. In which condition does the valve not close properly, causing backward blood flow? Option 1. Stenosis. Option 2. Regurgitation. Option 3. Both. Option 4. Neither. The answer is option 2. Regurgitation. Which of the following is a minimally invasive procedure for valve repair? Option 1. Open heart surgery. Option 2. Percutaneous valve replacement. Option 3. Transcatheter valve replacement. Option 4. Valve stenting. The answer is option 3. Transcatheter valve replacement. Which is the main cause of tricuspid regurgitation? Option 1. Congenital defects. Option 2. Infections. Option 3. Right heart failure. Option 4. Aortic stenosis. The answer is option 3, right heart failure. Which condition is associated with the thickening and stiffening of valve leaflets? Option 1, mitral regurgitation. Option 2, aortic stenosis. Option 3, mitral stenosis. Option 4, pulmonary regurgitation. The answer is option 3, mitral stenosis. Which valve is involved in pulmonic stenosis? Option 1, mitral valve. Option 2, aortic valve. Option 3, tricuspid valve. Option 4, pulmonary valve. The answer is option 4, pulmonary valve. Which is the most common cause of aortic valve regurgitation? Option 1, congenital defects. Option 2, bacterial endocarditis. Option 3, aortic aneurysm. Option 4, rheumatic heart disease. The answer is option 2, bacterial endocarditis. Which of the following is a risk factor for developing valvular heart disease? Option 1, smoking. Option 2, obesity. Option 3, hypertension. Option 4, all of the above. The answer is option 4, all of the above. Which is the first-line treatment for mild cases of mitral valve regurgitation? Option 1, surgical repair. Option 2, medications. Option 3, lifestyle changes. Option 4, aortic valve replacement. The answer is option 2, medications. Which of the following valves can be repaired or replaced using a catheter-based procedure? Option 1, aortic valve. Option 2, mitral valve. Option 3, pulmonary valve. Option 4, all of the above. The answer is option 4, all of the above. Which of the following is a complication of untreated valvular heart disease? Option 1, heart failure. Option 2, stroke. Option 3, arrhythmias. Option 4, all of the above. The answer is option 4, all of the above. In which condition does the valve become narrowed? Restricting blood flow. Option 1, stenosis. Option 2, regurgitation. Option 3, prolapse. Option 4, all of the above. The answer is option 1, stenosis. Which is the most common cause of mitral valve prolapse? Option 1, genetic defects. Option 2, infections. Option 3, hypertension. Option 4, aortic aneurysm. The answer is option 1, genetic defects. Which is the goal of surgical treatment for valvular heart disease? Option 1, preventing valve rupture. Option 2, restoring normal valve function. Option 3, relieving pain. Option 4, reducing blood pressure. The answer is option 2, restoring normal valve function. Which of the following is a type of minimally invasive surgery for valvular heart disease? Option 1, open heart surgery. Option 2, valve repair via catheter. Option 3, coronary artery bypass surgery. Option 4, cardioversion. The answer is option 2, valve repair via catheter. Which is the main complication of untreated mitral regurgitation? Option 1, arrhythmia. Option 2, stroke. Option 3, heart failure. Option 4, blood clots. The answer is option 3, heart failure. What type of valve is commonly used in valve replacement surgery? Option 1, mechanical valve. Option 2, Biological valve. Option 3. Both A and B. Option 4. Neither A nor B. The answer is option 3. Both A and B. Which of the following is a symptom of tricuspid stenosis? Option 1. Edema. Option 2. Coughing. Option 3. Tachycardia. Option 4. Chest pain. The answer is option 1. Edema. Which surgical technique is used to repair aortic valve regurgitation? Option 1. Valve excision. Option 2. Aortic valve replacement. Option 3. Mitral valve repair. Option 4. Pulmonary valve repair. The answer is option 2. Aortic valve replacement. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life.